kind of 24/7 availability to the doctor. So, comfortable. It's going to be up to the US standards. If your kid gets sick here,
Welcome to Palace Conversations. Meet your host, Simon Hornstein from PalaceLife.com, your international immigration partner, speaking with Dr. Dario Antonio Vallarino, Panama's trusted BabyDoc, specializing in pediatric care.
You have a remarkable career in pediatrics. You studied medicine in the University of Panama, neonatology at the University of Tennessee, and then pediatrics at the Miami's Children's Hospital.
correct.
Like, what inspired you to specialize in this field and choose this path?
Great. So, my dad's a pediatrician. So I grew up kind of like seeing how that world worked. I really like medicine. Initially, I wanted to go like in the surgical field, but then once I started really knowing how the surgeries worked, then I veered away. And then the more I went into actual studying of medicine, I really started enjoying working with like kids and then just spending time with them. So I decided to go into the pediatrics field. Then when I was in the pediatrics field, I really liked the intensive care part. I really liked like deliveries and seeing babies born and everything. So that's how I decided to go into the neonatology world, which is like the newborn ICU, I say.
And why did you choose to come back to Panama after being in the US?
So that's a good. So essentially, I stayed in the U.S. for 10 years. But my wife is a Panamanian as well, and I'm Panamanian. My whole family's here, and like I said, my dad has his practice here as well. So my plan was to come back and kind of like not take over, but help out with the practice, and I just wanted my kids to be back home with their family and our family and friends. It's just it's a nicer kind of more family environment for them here.
Yeah, so having your family history and your work experience in the US, like, what is the vision behind your clinic here in Panama?
So long term, I would like, I try to practice, kind of like the US, I practice US standards. My long term plan is to kind of, grow the practice and then bring people in like, Panamanian trained pediatricians and kind of like, get them to practice, the US standard and be able to kind of multiply my office into different offices. That's like the long-term vision. That would be the ideal scenario.
And what are some services that you offer that sets you apart from other pediatricians here in Panama?
So I think, the official title is Concierge Pediatrics, and that's kind of known in the U.S. like a concierge medicine. And what that entails is basically when somebody comes to the practice or has access to the doctor, essentially 24/7, right? I try to always be available for patients. We always try to open up spaces in the office to see the person, like same day appointment. Like I said, if there's any emergencies or anything, I'll be like I'm the one that if patient needs to go to the hospital, I'll be there as well. So we try to provide like very complete care from the beginning of birth, like because I do a lot of like newborn like deliveries, till older if there are any complications or anything. I try to cover everything essentially.
And that didn't exist before in Panama.
I mean, there's always been some people that practice that way, but there's always room for more.
And we don't have that in Germany.
Yeah, no.
So-
In the US there are some, like I said, concierge pediatricians. I don't know in Germany, but like in the US there are, and they practice kind of the same way, right? Like so you have that kind of 24/7 availability to the doctor. So I'm readily available via texting or phone. Like I said, if they need to come to the office, there's always some slot, even if we have to work late. We're always here. So yeah, that's one of the things that sets us apart for sure.
So yeah, many people that consider emigrating to Panama, they don't know how the Panamanian healthcare system works. They have not heard about it before. How would you say, like, what are the biggest differences between the American healthcare system and the Panamanian one, and how does it help?
So the Panamanian healthcare system, especially for somebody who's emigrating, I mean, it's different in the sense that it's a little bit more personalized. So there's not that many doctors. It's not like like the US, like the network, kind of like their insurance. Now, I mean, there are, of course, insurance providers here, but not as strict as in the US. So you have a little bit more flexibility there. Same thing with kind of like the hospital. So you kind of get to choose which hospital you want. So you have a little bit of more options when you come to Panama. I mean, in Panama, there's a lot of very well trained doctors. So we have doctors that are trained in the US, European trained, Central America, South America. So we have like very different specialties that are trained elsewhere. And I think the main difference that you can see is kind of like that kind of one-to-one kind of experience. You get to have a little bit more access than the doctors in the US. Kind of the US is like, you call the office, whoever's available, they'll give you an appointment whenever. And then here you kind of have a little bit more one-on-one with a doctor.
Yeah, so for many people, the American healthcare system is one of the best in the world. So you say it's even a little bit better than the American,
Well,
or like more personal?
of course, like in the technology department, of course, the United States is, way ahead. Volume department in regards to like they see so many patients.
Yeah.
So the doctors there are like super specialized. So if you need, a doctor that only does, one special valve of the heart, you're going to have that type of doctor, which you don't have here because we don't have that many. The population is not as big, right? So of course, like technology, hospital standards, that thing, the United States is a level on its own, right? Like that's why they are superpower in health and everything. So in that sense, we don't compete there, but we can kind of compete in the sense of like availability, like a human resource kind of type of picture. So that we have. We do have a lot of technology in the region, at least compared like the hospitals here. At least the main hospitals have Joint Commission-accreditation, which means that the Joint Commission, which is a United States entity, comes down to Panama and they certify the hospitals that are up to American standards. So we have some hospitals that have those U.S. standards, and so at least people when they come down here, they know that the standards are going to be at least at the United States standard. So that's a good thing. But I can't say that that we're better than the U.S. in that department. I wouldn't reach out that far.
And I mean, why is it that doctors have more time for patients here in Panama?
I think, like I said, it's a volume thing, right? It's a population thing. So even though we have less people, population. So even though there's more doctors in the U.S., there's more population as well. So doctors have to see, I don't know, twice as many patients than what we see here, just like the way that everything's set up. So here we can kind of slow things down and then, take our time and have more access and more time with the patient, like more one-to-one time. In the United States, which is a good thing, I mean, they have, nurse practitioners. So it's a different system, right? Like there's a lot of support staff for the doctors here. The doctors have more of that one-on-one with the patient. Again, I think it's just a matter of a volume, like patient volume here versus in the US.
And what would you like to share, or what would you tell parents that consider moving into Panama and are a little bit worried about the healthcare for their children?
Oh, absolutely. So I think that, actually I take care of a lot of expats from different countries. And there should be no concern. I mean, we have, like I said, all hospitals, we have very good specialists, we have very good labs, we have, there's really nothing that we're lacking here for, general care of pediatric patients in general. Like you can come down here and have your delivery and it's going to be safe and it's going to be, comfortable. And it's going to be up to the U.S. standards. If your kid gets sick here, we have all types of subspecialists and everything. So people can move down here without any sort of hesitation or anything that they're going to have a top-notch healthcare here for sure.
And I saw also that you sometimes go to Miami for patients.
Correct. So I'm still licensed in Florida. So I have my U.S. medical license. And I also maintain my what's called the medical board. So I'm board certified in Pediatrics and Neonatology. And so I go to the United States. I still practice in Miami. I do my IC, some like the neonatology ICU part over there. Same thing, just because there's more patient volume there, just to kind of keep up with, what's new, patient cases, and it's just kind of to keep it interesting and to keep connections, which is another wonderful thing. Panama is actually, very close to Miami. So sometimes, which is not often, but if we do need something in regards to like sending a patient for a second opinion in Miami, or from a doctor, or if they need anything special, I always like to keep in touch with them. So it's I tell parents that the specialists there are always like a phone call away. So I can I have the numbers of a lot of specialists in Miami. I call them and say, hey, I have a patient from Panama. I need to I need a second opinion or whatever, and we can make that happen. So that's one of the things that I keep going to the US for that.
What is a secret about Panama that foreigners don't know and that you would like to share with us today?
I think Panama, I think it's a great country when you compare it to other Central American countries. I think when I talk to people from other countries, that I hear like other realities. I mean, Panama's very safe. I think I've lived here all my life except those 10 years in the US, but I've never really had to be concerned about safety, outside, like driving anywhere, walking anywhere. My kids as well, the same thing. I mean, economy wise, I think it's pretty strong. I mean, we have the US dollar, which a lot of people don't know. Like, they think that we have some sort of like different coin or currency, sorry, yes. And no, we have the US dollar, so it's 1-to-1, and so it's very easy to come down here with a dollar. And we have a lot of, and since we also had a lot of US influence from the Panama Canal, it's very comfortable as well. So we have a lot of stores from the US. We have a lot of things that very similar, at least for the people that are used to like the international stuff. You have a lot of that here, which you might not have in other countries in Latin America.
Thank you so much.
You're very welcome.
Thank you for
the interview.